Some surprising numbers here. JCPS says 12,000 students are not up to date on their measles vaccinations, and that is about 12.5% of the entire school district population.
This as health officials are tracking a measles outbreak in Columbus, Ohio. I talked with JCPS about what it's doing to prevent an outbreak here. The CDC, Centers for Disease Control and Prevention, is warning the Louisville area about a Columbus, Ohio measles outbreak, putting Kentucky's largest school district on high alert.
Measles is one of the most contagious illnesses.
Columbus Public Health says the outbreak started in November. Since then, there's been 85 cases, all in kids under 18. 34 of them had to be hospitalized.
We know from the Columbus outbreak that close to 40%, maybe above 40% of the children who have gotten measles have had to be hospitalized. So this is very important.
JCPS is now adding the MMR vaccination, measles, mumps, and rubella, to its vaccination clinics. The district is also pinpointing schools with low vaccination rates for clinic locations. JCPS says nearly 12,000 students are not up to date on MMR vaccines.
We work to prevent the spread of illness in our schools, and vaccinations is a big piece of that.
Norton Children's Dr. Chris Bryant says symptoms include rash and a fever. People can also have a cough, runny nose, and red eyes.
Measles is not on most parents' worry list. That they've never seen a case of measles. We don't hear about measles much anymore. And that's because the vaccines work so well.
Dr. Bryan says Louisville hasn't seen a case in a while, but that can change.
The situation in Ohio is really a warning about what can happen when we have groups of unimmunized or under-immunized kids in a community.
The first clinic for JCPS students is Tuesday at Iroquois High School. Students will need a guardian to fill out an authorization form.